Hi, my name is Miranda French, part of the Nursing Leadership 1 class, and I'm doing my presentation on the ANA proposition statement of nurses' role in addressing global Earth climate change, climate justice, and health. This background image is from NASA in 2020, just last year. It's showing greenhouse gases fluctuating in the Earth's atmosphere throughout that year with the highest concentration in red. Pretty alarming, especially with us over here in North America, pretty covered in red. Here is a statement of the ANA proposition of this healthcare policy issue addressing global climate change, climate justice, and health. The ANA recognizes that climate change is a critical public health issue that requires urgent action to mitigate its impact on human health and well-being. Nurses are called upon to integrate science of climate and health into nursing education, research, and practice, and to work with other healthcare professionals, community organizations, and policymakers to address the multiple health consequences of environmental degradation, extreme weather events, and other climate-related health impacts with evidence-based mitigation and adaptation practices, programs, and policy. And this statement reflects ANA's adoption of the precautionary principle and strives to encourage our profession to be proactive and responsive to environmental changes and climate-related events we see happening around the globe. It's important to be part of generating solutions to the effects of those changes on health outcomes of our patients. So I feel like this is a pretty big topic, can sometimes feel overwhelming, but the ANA goes through some of the things we can do. So let's talk about why is this significant to nursing. As global climate worsens, global health and living conditions worsen, which can lead to the overwhelming effect back on us in the healthcare system. The WHO recognizes climate change as the biggest health threat facing humanity. Pretty big statement there. And the climate change is affecting the environmental and social determinants of health, like clean air, sufficient food, safe drinking water, secure shelter. From 2030 to 2050, so just in the next 7 to 6 the next couple decades, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, heat stress, and diarrhea, which are all preventable deaths if treated properly. And that can also come back on the healthcare system. ANA adopted precautionary principle, which is what it talked about earlier, how it incorporated that into their statement. And that's from a consensus in 1998. It's when, and they say this is precautionary principle is when an activity raises threat of harm to human health or the environment. Precautionary measures should be taken even if some cause and effect relationships are not fully established scientifically, which is basically like a modern restatement of the classical Hippocratic Oath. I will keep them from harm and injustice, or first, do no harm. So that is basically what the precautionary principle is. It's just preventing harm. If there's threats to humanity, we should take actions, even if there's hard to understand what the future might hold, especially with the evidence we have now. And NASA's global climate change research. So it states two main approaches. Earlier in the ANA proposition statement, I was talking about mitigation and adaptation. Mitigation is reducing the emissions and stabilizing the levels of global climate carbon that we have in the atmosphere already. And adaptation is adapting to what we already have present. So mitigation is trying to make it not so worse, like preventing it from increasing, stabilizing our levels. Adaptation is just adapting to what we already have destroyed or harmed. So the purpose or aim of this project is increasing knowledge and advocacy of nurses' role in addressing global climate change, climate justice, and health. Population, planet Earth, globally, and local communities we need to decrease climate change and effects on health. I'll go into the comparison of other populations and different communities on Earth and how it's been affected by climate change. And the overall outcome is to increase positive health outcomes that can be affected by this climate change, help mitigate it, and prepare for issues and challenges from the complications, and decrease and stop it from getting worse and affecting global health. So here it goes over kind of the pathways of how climate change can affect human health outcomes. So especially for vulnerable factors, lower socioeconomic, geographical factors closer to the poles with less resources, lower health status, and all the pathways it can affect is air quality, heat stress, extreme weather events, food insecurity, water insecurity. It can increase the rate of vector diseases like diseases from ticks and mosquitoes. So these are all high, increasing morbidity and mortality overall, which overall affects our healthcare systems and affects us as healthcare providers as well as resources. So here's some more evidence talking about direct damage costs is estimated to be $2 to $4 billion per year by 2030, which excludes costs of even agricultural water and sanitation. So the largest increase, there'll even be increases in refugees and border crossings. As climate worsens, many of these people in the tropics and third world countries will have harsher environments of climate change, creating mass migration and even refugees and climate. So it's just overall affecting all kinds of issues we're trying to face, making them worse, and has direct consequence on the healthcare system. And this is important because the healthcare sector is a significant also contributor to climate change. It makes up 8.5% of the total greenhouse gases emitted by the U.S. And the U.S. Healthcare also accounts for nearly 20% of the GDP in the U.S., making it a major consumer for resources. So it's also important for us to think about how are we using our resources in healthcare. And more studies have shown how our environment and our health are just linked together. And so like human and ecological risk factors like coal-fired burning plants, removal of coal, offshore oil, natural drilling, and the impacts of these coal, oil, and natural gas extraction on local communities like drinking water, animals, farm animals, air pollution, local streams, noise levels, drilling accidents, even vehicle accidents. And it's important for us as healthcare providers to make sure there's public safety and knowledge about monitoring where these coal, oil, and natural gas extractions are taking place, as majority of them are on Native American lands, which are vulnerable populations already with food and healthcare deserts and having higher health poor outcomes. Native American lands make about only 5.8% of the U.S. land, but hold over 20% of the natural and oil reserves for U.S. So this is just an image of a local community here in the Southwest Colorado region. And there is a great use of 91% of the land over in the Greater Chaco region, which is majority Native American Indian tribal land, is natural gas drilling. And it's been increasing with an estimated of over 400 new wells in this region to be drilled annually since 2010. There are some policies now to restrict that, but it's still increasing, and we need to work on mitigation strategies to help prevent these vulnerable populations from the effects of the drilling to their water supply, to food and resources, and adapt to the climate change on health in these areas. So here it goes over more of the health effects of climate change. Air pollution could cause more asthma, severe weather effects, more injuries, fatalities. Extreme heat can increase cardiovascular diseases, environmental degradation, forced migration, mental health impacts, water and food supply impacts cause diarrhea, malnutrition, harmful bacteria infections, and the list just goes on. Increase in like diseases from ticks like malaria, encephalitis, Lyme disease, West Nile. These are all will be increasing. And the CDC goes over some of the different regional effects as well. So if you go on their website, you can see what region, and so Colorado's in the Southwest. So there is an increased risk of heat-associated deaths, increased premature deaths due to heat, and increased infectious diseases like the plague in West Nile, with vulnerability to water shortages from food and drought. There's also a human climate and human health assessment by the USGCRP, and they go over action plans we can do, as well as research continually of how we can tackle this. And the EPA also has research, and it goes over some of the majority greenhouse gases that trap heat in the atmosphere from human activity. So the main driver is carbon dioxide, makes up majority. And then there's methane, nitrous oxide, and fluorinated gases, which are two things we see in anesthetic care here as healthcare providers. And fluorinated gases actually have, even though they're the lower percentage makeup, they actually have a very high global warming potential. So even small concentrations can have a large effect because they last so long in the atmosphere. There is an American Society of Peri and Anesthesia Nurses that are recognizing this, and they're acting upon how we can control the waste of anesthetic gases to help decrease effects on the environment and human health. So this is just from the IPCC report. It's showing comparison of different regions of the world and how climate change is affecting the human health systems and human systems in different regions. So if you look at North America, across the board, so if it's dark color, it's very high confidence in the impact, whether it's increasing adverse impact or decreasing. So overall, it shows that U.S. North America has one of the highest negative impacts on all of the health and well-being from climate change compared to other regions, which is kind of sad because we are like more of a established country, and how we're just still affecting our health and well-being because of climate change, including infectious diseases, heat, malnutrition, mental health, and displacement, which are all things we need to address. So our nurses' role, what is our role? We are committed to the environment and health. We know these are linked together, and we cannot separate these. So there's different statements we must follow as nurses. There's the Code of Ethics for Nurses that guide our ethical practice that state we must follow, especially with the statement in 9.4. It talks about advocating for policies and practices that prioritize health and safety in face of climate change. There's a scope and standards of practice we must follow to conduct assessments of environment and risk exposures that impact health, especially vulnerable populations, and engaging in community-based practices to help promote health and resiliency and prevention of hazards to people and the natural environment. And then the nursing social policy statement, which we must follow, and it's got about 4 statements: one on hazardous service, so extreme weather events, promotion of health in the public, workforce sustainability, and protection in hazardous service. So we definitely need nurses' role in addressing the social determinants in health and the impact of climate change on those health impacts, with our knowledge and expertise to identify and address social and economic and environmental factors that contribute to the health disparities and climate-related health impacts. This is the House of Delegates resolution. So ANA met with them to make this House of Delegates resolution in 2012. And it's the nurses' role in recognizing, educating, and advocating for health energy choices. So it goes over what can we do as nurses to help out, and we can focus on decreasing fossil fuel use, increasing energy conservation, expanding utilization of healthier, sustainable forms of energy and renewable energy sources. So educating other professionals and the public on the relationship about human health to critical energy issues, and encouraging policies that promote and incentivize healthiest option for long-term energy sources and energy conservation and sustainability, as well as constitute member associations and affiliate partnerships to help address these health issues with energy, with education and policy and advocacy. Supporting activities that monitor, reduce, and remediate health environmental risks for individuals where coal, oil, and natural gas extraction and use are occurring, so like in Native American lands or areas that are close to living communities so they're protected. Making sure that we try to, as a public health standpoint, monitor, report, and regulatory to protect the public health and the environment, and collaborating with national groups to help prevent these areas from fracking and harming the environment and human health, and as well as collaborating energy policies incentivize energy conservation. So the nurse's role, there's also an ANA's principle of environmental health for nursing practice with implementation strategies. So this is a guide for nurses on sustainable environmental healthy nurse actions and practices. And the ANA also has two more related proposition statements that are similar to this one. One's the nurse's professional responsibility to promote ethical practice environments. And the other one is nurses' role in ethics, human rights, and protecting and promoting individual worth, dignity, and human rights in practice settings. So we need to make sure that we improve our ethical climate in all practice settings, and provide foundation related to human rights and of all nursing practice, ensure that human rights are protected and promoted. And so how can nurses make a change and advocate for this issue? There's a whole list of stuff that we as nurses can do, and it's more than you think. It can be overwhelming, this big challenge, but even small steps, one by one, and just staying knowledgeable and up to date about information and public health as nursing leaders and helping advocate for healthy outcomes in our community is a major thing that we can do. So just becoming knowledgeable, even joining an advocacy or coalition team, educating your community about local health impacts of climate change. So if there's increase in wildfires, increase in mold from flooding, food insecurity from droughts, preparing for natural disasters like hurricanes or storms, getting involved in national and local organizations, including team meetings about climate change and effects on human health, even starting your own data analysis on small changes on your unit or workplace and presenting data to your managers to evoke change at work. Helping maintain sanitation and clean water and food security to the public to mitigate climate change and impact on the community. To promote social justice, so equity, advocating for policy change and help prevent environmental damage in pursuit of economic self-interest, especially in communities of poor or color, which often face the highest social, environmental, economic, and health costs. Helping promote reproductive rights as well, so women's autonomy to choosing birth control. So women globally have a choice in their own bodies, helping control unwanted pregnancies, uncontrollable spikes in populations. So women's autonomy also plays a role. Promoting environmental justice by implementing use of technology and medical equipment that is biodegradable or decreasing carbon imprint for material used in the medical field. Some more nursing interventions, so educating, promoting strategies to respond to the impacts, ensuring that institutions prioritize the nursing workforce and capacity as a component of natural disaster and climate adaptation preparedness, advocating for robust public health infrastructure and public health nursing workforce on how to care for the impact of these events that can happen, supporting decarbonization in the healthcare sector to reduce carbon emissions. So climate smart healthcare, reducing waste, diverting waste from landfills and hazardous streams, supporting forms of transportation with low to no greenhouse gases, so carpooling, public transport, supporting electric vehicles instead of fossil fuel vehicles. So if there's a hospital or clinic with more EV chargers, effectively capturing, preventing waste from anesthetic gases, using environmentally preferred purchasing strategies, so helping decrease the anesthetic gases like nitrous oxide and fluorinated gases, supporting transition to responsible renewable energy. And here's some more interventions we can do in the professional setting, so in the hospitals and clinics. Again, advocating to the leaders and administrators to commit to decarbonizing the healthcare delivery and making measurable goal progress on our effects of decarbonizing helping, or reducing waste, is that helping, addressing pollution by the nursing practice, establishing goals and metrics to improve plans to reduce, integrating climate and sustainability content in nursing schools, so educating new nursing students about reducing waste, energy and water conservation, climate leadership and advocacy and practice, supporting nursing research and innovation, which it's really important to have nursing research to address climate change and justice, partnering with Indigenous Americans on planet-friendly living, partnering with them, collaborating with across sectors and communicating to address climate and environmental health issues, creating opportunities for nurses to decrease environmental impacts of their practice, and advocating for actions that reduce greenhouse gas emissions in healthcare delivery, and for decisions about purchasing policies and practices to be made to reduce harm and ensure climate justice and equity. So, evaluation of these interventions. At 6 months and a year, we could evaluate for public health rates of issues related to climate change after implementing a policy change to help with decarbonization and adaptation to climate change. So, is there clean water? Is that increasing rates? Food security, is that seem to be increasing? Infectious disease rates in local community like West Nile, the plague. So evaluating community education levels as well on climate change. Are people feeling more knowledgeable about this and the risk to health and the benefits also of energy conservation, renewable energies? So we could do a survey study looking at these health outcomes, factors, and educational levels. And then at 2 to 3 years, we could continue to evaluate compliance with this new policy change. Is it still benefiting? Is it harming? How is it helping the community? As well as maintaining positive outcomes with or without policy change enacted at the workplace environments. So conclusion, overall recommendation for next steps, we still need to get more knowledgeable about climate impact as it's changing every day. Research is showing new things on public health, environmental health, and local and community challenges, changes to implement and to get involved with advocacy to help promote public health and mitigate climate change effects locally, joining local advocacy or coalition group and professional organizations to stay motivated and active to help promote public health change. The ANA Enterprise also has a platform where you can apply and promote nursing innovation. So they help with nursing funding for research, which funding is a big issue. So if you go on their website, you can look for funding to help with research and innovation for nurses to help with climate change and climate justice at the local, state, and federal levels. Nurses overall bring hope as we're trusted voices in the community. And we can help promote the cultural and structural changes to help with climate justice, justice, as nurses are trusted speakers to speak truthfully and act ethically and advocate for people on our behalf. Nurses are system thinkers with holistic view, which is very unique, and understanding of humans are deeply interconnected and part of Earth, allowing us to grasp the impact of social, structural, and environmental determinants of health. Nurses are relational experts as well. We need interdisciplinary relationships across geographic and demographic boundaries with respectful and collaborative partnership in order to elicit transformative changes to solve climate challenge issues. Working with collective nursing organizations to leverage their advocacy on local, state, and national levels to help support the interests of nurses, as well as advocating for health issues that affect nurses and the public. So we can evaluate this program a couple of different ways. We can do a risk cost benefit analysis, RCBA, to resolve dilemma of the cost of these ethical choices following the precautionary principle about the net benefits of action to minimize the effects of exposure to serious environmental hazards. We could also apply the research, education, advocacy, and practice framework, so REAP framework, to evaluate and identify further nursing interventions that advance equitable climate solutions to improve human health for all people and sustainable health lifestyles. So we could do that framework. Overall, our goal is to help promote and achieve planetary health. So environmental and human health, addressing the issues of the effects of climate change that directly impact the health of our patients, communities, nursing practice, and work environments and nursing ethics as we embark on critical work to heal our planet. The frequency and intensity of climate-related issues continue to rise, and nursing profession has an ethical obligation to work hard to address, mitigate, and adapt to causes and effects of climate change on human health, stated by the ANA. So we must recognize and educate that the health concerns related to climate change exacerbate every other issue that we're facing in nursing that we're already working to resolve. So it's important to address this major issue. So here's some ways more to get involved. There's a Nurse Climate Challenge. You can be part of and be a champion with education and advocacy. There's a nursing collaborative on climate change and health. You can learn more and join the committee. There is a National Academy of Medicine action collaboration, and there's they have kind of a follow key impact you can do, how you can impact your community, and they have ways you can implement your ideas. There's also a local Southwest Colorado environmental activist group, so there's even more probably in different regions where you live at. And thank you guys so much for your time and patience.